Surgical Supplies Lecture. The minor surgery room, changing room, and minor surgery room are separate from the other exam rooms. So the patient changing room should be very separate from where the actual procedure takes place and where we see patients for the routine physical exam. The changing room should be near the surgery room, and the surgery room should be near where the workroom is with a sink and an autoclave. The room should be easy to disinfect and unclutter. The minor surgery room should contain an operating table, clock, operating light, sitting stools, and Mayo stands, cabinets that store supplies, and some countertops. Surgical solutions and medications. You are responsible for the care and maintenance of supplies, so having sterile water, a sterile physiological saline, or we often call this sterile saline, surgical scrub preparations like chlorhexidine and betadine, or you will also hear it called ChlorPrep, Hibiclens, or betadine, which are preferred surgical scrubs over hydrogen peroxide or alcohol. Anesthetics such as lidocaine, formalin solution, and specimen bottles. These are used for biopsies. Topical silver nitrate should be in the room to help stop bleeding. We oftentimes use silver nitrate sticks for epistaxis. Here is a picture of the average operating room and the equipment within it. Surgical instruments. Know which instruments are used for each procedure and be able to identify and understand the function of the surgical instruments preferred by the physician. Instruments have clearly identifiable parts and can be visually differentiated. Components are handles, closing mechanisms such as ratchets, and the parts that come in contact with the patient. So whether the instrument has serrations or jaws or is just plain. So here's a picture of an instrument with different handles. These are called ring handles. As you can see, this instrument has ratchets. Ratchets are used to lock instruments into position. This instrument has jaws or teeth used to grasp denser tissue. This is a picture of instruments that have serrations. Many of your hemostats and forceps will have serrations. There are 4 different groups of surgical instrument classifications that you will want to know. The first group is the cutting group, which consists of mainly scissors and scalpels. The grasping group consists of hemostats or forceps, also called pickups. Retracting instruments are your Sen retractor, which hold tissue away from the surgical incision so you can get better exposure. And then you will have probing and or dilating. The difference between probing and dilating are: probing is used to search for a foreign object, and dilating is used for opening and widening of a surface. Care and handling of instruments. Proper care maximizes the life of an instrument and ensures it is a safe working order. Stainless steel resists rust and dulling, but needs to be dried carefully. Carefully examine all new instruments when purchased, and never bundle instruments together or allow them to tangle. You will want to inspect instruments for any cuts or changes in the surface which can expose the area and cause the area to rust. Cleaning instruments. After the surgical procedure, contaminated instruments should be placed in a basin of disinfectant solution. Transfer to the disinfection and sterilization room, rinse thoroughly, wash by hand or ultrasonic devices for sharp instruments. After disinfection and inspection, sterilization occurs after wrapping has been done. Drapes and sutures. Disposable surgical drapes are placed over operative areas using sterile technique. Ideal suture material is easy to handle and non-allergic, strong without cutting through tissue, and it can be sterilized. Types of suture material. There is absorbable sutures that dissolve by the body during the healing process and are used for deep incisions and lacerations when removal is difficult. Non-absorbable suture material is left until healing is complete in minor procedures. Surgical staples can also be used of stainless steel or titanium for bigger wounds. So here's a picture of the different types of suture material that you can encounter. As you can see, there are different names and types, but the importance that we really need to identify is the size. Oftentimes, a physician will request a particular suture size. And you will see on this package here in green that 4-0, this would be the size. This one is 2-0, this one is 3-0, this one's 2-0, and usually it is always in the upper corner. This size is 0. And sizes of suturing can be all the way up to 6-0 and there on up, but 6-0 is really the smallest suture that I have encountered. And sutures can go up all the way from 0, 1, 2, and 3, and those are larger caliber sutures that hold together wounds that are more gaping. The 6-0 is the finest material, and typically these types of suture are used on facial wounds. So there are different needle shapes, as you can see, and some needles are already swagged. And what swag means is that the suture material is already attached as seen here. Patient education. Allay patients' fear by answering all questions about the instruments the surgeon will use. Legal and ethical issues. Know that surgery is planned and whether the patient has been informed about the procedure. Realize the full extent of your role as the patient's advocate and the physician's agent. Confirm that the physician has explained the surgery to the patient and that the patient has signed an informed consent.